Hey everyone, this is Dan Kamenstein. I'm going to spend a couple minutes just going over the answers to the pre-lab quiz and the post-lab assignment. Hopefully this will help clarify what we went over in lab and prepare you for the next lab as well. So question 1 on the pre-lab quiz was asking you what was wrong with this image here. So in this image we see an ultrasound of an aorta as well as the spine and the IVC. And the problem with this image is that there is entirely too much depth. So as we talked about in the lecture, when you're looking at structures, you want to try to center them on the screen. So here we see that we actually have up to 30 centimeters of depth, which is marked on the side there. Our aorta is actually about 3 centimeters deep, and so we want to try to optimize the image so that the aorta, which would be the structure we want to look at, is centered on the screen. Even if you weren't sure what you were looking at, you should be able to identify the fact that there's a lot of this ultrasound screen that is not being used by any structures or images, and so that we have too much depth here. So there's the aorta, the spine is right below it, and that's really the main structure that we would want centered on the screen in this image. Question 2 asked about what was wrong with this image, and this, as most of you were able to identify, is an image that has too much gain. So this is overgained, the image is too bright, and you lose any resolution. So again, this would be an image of an aorta as well as the spine, but the brightness of the screen washes out the image. And then question 3 asked the same thing about this image, and again, this image is too dark, so there's not enough gain. Again, if you have too much gain or not enough gain, you lose resolution on the screen. You're not able to identify structures very well. The point of these 3 questions was really to get you to think about optimizing your ultrasound image. And as we had discussed in the lab, being able to optimize the image in terms of adjusting gain and depth are very important skills to have. And we wanted you to start thinking about those before you went into lab, so that as you went into your ultrasound lab for the first time, you were thinking about how to change the gain, change the depth to make your images look as optimum as possible. Question 4 asked about what was wrong with this picture, and this is again an image of someone holding the probe incorrectly. So holding the probe far away from the patient, and as we discussed, you want to hold the probe in a pencil grip and then brace your hand against the patient in some way so that you can stabilize the ultrasound probe and also make sure that you can have good control over the probe. So that is it for the pre-lab quiz. We'll go on to the post-lab assignment. Question 1 asked you to post your 4 images. And so that's what the 4 images should have looked like. You should see the carotid artery and internal jugular vein in short axis, and then images of the carotid and IJ in long axis, and then 1 image of the brachial artery and brachial veins. So in question 2, we asked you to point to the vessel that would likely be collapsed in your roommate if they stood up very quickly. And what we wanted you to identify was the internal jugular vein in short axis. Because the jugular vein is gravity dependent, when someone stands up, almost always that jugular vein will be collapsed in a healthy person. The carotid artery should not change significantly in diameter based on position, because the carotid artery is under quite a bit higher pressure. So the arrow should have been on top of the jugular vein, as you see in this image here. Question 3 asked you to post the long axis image of your internal jugular vein and carotid artery and indicate the direction of blood flow. So here we see the carotid artery. Blood flow should be towards the head. And as we discussed in lab as well, the marker on the screen, this little P here that we see at the top left of the image, indicates that the ultrasound probe should be pointing towards the head when you have a long axis image of the carotid. So correct position of the arrow in the carotid artery would be towards the left side of the screen and also towards the P in the image here. Opposite is true for the IJ. So in the IJ image, we should be seeing blood flow away from the head, and so the arrow should be pointing towards the right. Many of you asked me how you would tell the difference in a long axis image between the carotid artery and the IJ. A lot of this has to do with where your probe is, but the other thing that you can pick up, which is somewhat subtle, is that the carotid artery has thicker walls. So here we see in the walls here, especially the proximal wall, that the artery walls appear a little bit thicker compared to the thinner walls of the IJ. This is pretty subtle. We wouldn't expect you guys to pick this up early in your medical school careers, but it is something you should be aware of as you think about anatomy further. The main reason that we emphasize that you should label your images before you left the lab is so that you can remember when you're looking at them which one was the artery and which one was the vein, as they can be difficult to tell the difference. Question 4 asked you to identify what the most likely thing you would hear if you listen with your stethoscope over the neck of a patient with this below. And this is an image of carotid artery stenosis. And the correct answer here would be a high-pitched bruit. Again, talking about the difference between laminar flow, which is silent, and turbulent flow, which does create noise. And the final question asked you to put an arrow over the ideal place to place your stethoscope if you're listening for someone's blood pressure with a manual blood pressure cuff. And we wanted you to put the arrow over the brachial artery, as this would be the best place to hear the Korokov sound when you're taking a manual blood pressure. Now, as you see in this image here, the artery and several veins are labeled. There was several questions about how you would identify the brachial artery when you're in the ultrasound lab, and I think this was the image that most of you had trouble with. And just to emphasize something that I talked about in the lab was when you're trying to differentiate between arteries and veins, you should take advantage of the lower pressure of veins compared to the higher pressure of the artery. So here we see an image here, several venous and arterial structures, and the question would be, well, how do we know which one's which? And if you watch this image here, as we pan down, we see arteries and veins. If I compress a little bit, I'll put a little bit of pressure, all the veins disappear, and the artery is the only one left. So the answer to how you best identify the brachial artery is put a little bit of pressure, and the only structure that does not collapse under light pressure is the artery. And we'll watch that again here. So we see that we pan down, I compress, all the veins collapse, and you can see the artery starts to pulsate just a little bit there. If I put more pressure, the artery would have pulsated more. So that's the answer to the questions for both the pre and post lab. Hopefully this is helpful to you. Please feel free to give us any feedback or questions you have about either the lab or this video itself.